So it's my distinct pleasure to introduce my colleague from Mayo Clinic in Rochester, Dr. Nkomo. He's the director of the Valvular Heart Disease Clinic there and extensive experience in not only clinical cardiology, but also echocardiography and interventional echocardiography. And most importantly, he's one of the nicest guys you ever meet. So, welcome. And he's going to be talking about aortic valve stenosis, echo assessment, and challenging cases.
Good morning, everyone. Thanks, Harry, for that kind introduction. I'd like to thank the organizers for the invitation to present at this conference. So we'll talk about aortic valve stenosis, and I'll show you guys a case that basically encapsulates all the different difficulties that you might run into when you assess a patient with aortic valve stenosis. I have no disclosures. Now, the thing that has come up, this is the most updated version of the evaluation of aortic valve stenosis, because the guidelines in a setting of someone with an aortic valve area of less than 1 centimeter squared, that suggests that that person has severe aortic valve stenosis. And then you have to think about aortic valve stenosis in terms of flow, which is the stroke volume index here. Less than 35 is low, and then 35 or more is normal stroke volume index. So think about it in terms of flow, gradient, and then ejection fraction. And you can have any combination of this, basically low flow, high gradient, normal ejection fraction, or low flow, low gradient, normal ejection fraction, or normal flow, low gradient, low ejection fraction. Any combination of these flow gradient patterns of aortic valve stenosis. And all of them in a setting of aortic valve area less than 1 suggest severe aortic valve stenosis. If you do get a gradient or a peak velocity of 4 meters per second and a gradient of 40 millimeters of mercury, you win. That's severe aortic valve stenosis, irrespective of what anything else shows, whether you have low flow or normal flow. The one caveat is that in a situation of normal flow, low gradient, normal ejection fraction, the guidelines say that that person likely has moderate aortic valve stenosis because of all the combination of flow gradients. That one has the best outcome without surgical intervention. So these are all the parameters of severe aortic valve stenosis. Aortic valve area less than or equal to 1 centimeter squared, index to body size less than 0.6 centimeters squared per meter squared. Again, a peak velocity of 4 meters per second or a mean gradient of 40 millimeters of mercury. Then there's this dimensionless index, which is a ratio of your left ventricular outflow tract signal to the continuous wave Doppler signal across the aortic valve. If that is less than 0.25, then that signals severe aortic valve stenosis. And again, the guidelines put more emphasis on 4 meters per second than 40 millimeters of mercury. So that if you have a valve